Hi, how are you? Good. I'm Nicola and I'm the senior dentist here at the practice. It's great to meet you. I believe that you are a new patient here with us today, is that right? Great. So, before we begin, I would just like to get some information from you, if that's okay. Perfect. Can I just start by taking your full name, including any middle names? Is that with or without an E? Okay, thank you. And your date of birth? Perfect. The first line of your address? And where's that? Okay, and your postcode? Perfect. And can I take a contact number, please? Can I get you to just repeat that? Okay, missed off the 6. Perfect. And can I take an email address, please? .com, was that? Okay. Perfect. Who is your doctor? And what surgery is that? Okay. Wonderful. And where have you been previously? Is that my dentist? Okay. How come the change? I'm just curious, not judging. Okay. Ah, I see. Okay. Oh, don't worry, I will have a good look. Yeah, that's what I'm here for. Okay, don't worry. All right. Okay. How long were you there for then? Right, okay, and you a couple of times. All right, don't worry. Okay, that's fine. Right. Do you have any allergies? Are you on any medication? And could you just list those? Yep. Okay. Okay, that's fine. That's not a problem. Do you have any health issues that need to be made aware of? Okay. And that's just the migraines, nothing else with your vision or anything like that? Okay, so you've got your migraines. What about your hearing in your ears? Are they all alright? Good. And what about any issues with your throat or anything like that? Have you had any problems or? Okay. Are you asthmatic or epileptic or anything like that? And what about diabetic? Okay. Have you had any recent surgeries? Okay. Have you got any metal pins or plates or anywhere in your body? Okay. That's fine. Any piercings or tattoos? Okay. That's fine. Let me just recap to make sure I have everything we need so I can pop it on the system later. Excellent, that's fine. Right, so when was the last time you had a check? Okay. And are you experiencing any problems at the moment with your mouth, your teeth, your gums, your tongue? Okay, so how long's that been going on for? Have you been bleeding from the gums or anything like that? Okay. Any sensitivity when you're brushing? Or about to any hot or cold things? Okay. That's fine. Do you experience any ulcers at all, or any cold sores or anything like that? Any issues with your throat, your larynx, or anything, tonsils and things like that? Okay. Okay, that's fine. Okay. Any jaw pain or anything like that? Any clunking? Okay. Any issues with your joints, your jaw, anything like that? Okay. Okay, it's fine, no problem. Wonderful. Okay. Looks fine. Everything looks in proportion just by looking at you, which is a good start, isn't it? So you've got pain in your teeth, is that right? Okay. Is it your wisdom teeth, do you know? Have they come through or? Okay, so potentially it could be coming through maybe. I'll have a look at them, don't worry. Okay. I'll see if we've got, you know, any abnormalities and things like that. Okay. So you'd like me to look at the pain, see what's going on. Obviously do a normal check, see if everything's as it should be, if there's any problems, etc. Then is there anything that you're particularly interested in yourself? Are you concerned about something? Are you wanting to change something? What is your problems? Okay, so you're potentially looking at teeth whitening, okay? And a clean, yeah, okay. So what we could do is actually do the cleaning, then carry out the teeth whitening, okay? Yeah, but today I'm just going to do the check. I want to make sure all that's fine and if anything needs treating or anything like that, and then I can get you back and then we can do the clean and we can do the teeth whitening for you. Is that all right? Yeah, it's quite a lengthy process when I do the teeth whitening, so it'd be good to definitely schedule that in and make sure, you know, your teeth are nice and clean beforehand. Okay, good. Right, perfect. So before I actually have a look, if you could just open your mouth for me as wide as you can and hold it. And close it. And open and close, keep going. Good. Now chew for me. So keep chewing. Wonderful. Okay, you can stop. Okay, you just give me a nice smile. Good. And relax. Okay. And just show me your teeth. Okay, and just pull up your upper lip. And you pull down your bottom. Okay, thank you very much. By looking at you and getting you to do the things that I asked, I it seems that your jaw is okay and is in line. Okay. Yeah, and I didn't hear any noises or anything like that, so that's good. I'm happy with that. Okay, just by briefly looking at your teeth, they do seem fairly straight. Have you ever had braces or anything like that before? Okay. Have you ever had any fillings or any tooth pulled out or anything like that? Okay. Have you ever done damage to your teeth at all? Okay. Good. Okay. Just show me your teeth again. Okay, you can relax. So I can sort of see what you mean by the discoloration. Alright, I can see that, and but just by looking I can see like we've got some plaque building up, okay, but I will have to have a look properly before I can assess that. Yeah, okay. That's just by having the first look. Okay. Yeah, but that's fine. We can sort that out with the clean, and yeah, that's fine. Before we do the whitening, see, we will have to get rid of any plaque and things like that. Okay. Yeah. Have you got any family history of any gum or teeth problems at all? Okay. And I take it you've never had anything. Yeah. Okay. Perfect. And finally, is there anything else you just would like to tell me, or that you're worried about, concerned about, or anything like that? Okay, perfect. Wonderful. Let's get my gloves and apron on. Yeah, if you could start that now for me. Thank you. You okay? Good. Perfect. Okay, so I'm going to start just by having a look in your mouth, okay? So I'm going to keep you like this for a moment. If you can just open wide for me. Say ah. Good. Can I get you to just pop your tongue right out for me? Wonderful. Curl it up. Good. Normal. Okay. Yeah. Okay. Relax. Pop in this depressor. Open wide. Push that down. Say ah. Okay. Okay. Put your teeth together. Relax. Thank you. Right, if you could now get into the correct position, if you wouldn't mind just helping, thank you. Okay, good. You ready? Right. Okay, I'm just going to have a look in your mouth, okay? Pull down. Okay. Yeah. Cough for me. Wonderful. Excellent. Make sure that lights. That's the thing. Right, so I'm just going to have a look now. If you can open wide for me. Plaque build up. A lot to the behind of the teeth. Yep. And mainly at the bottom on the front. Yes, please add that, yeah. Okay, I'm just going to so the plaque is coming off. Just try then that one. Yeah, this should come off really good with a clean. Yeah. Okay. Yeah, I'm ready. Good. So I'm just going to see strength. Any pain there? Okay. Yeah. Erode it, yeah. Reddening of the gums. And slightly receding there on the bottom. Does that hurt at all? Okay. Yeah, it's very so we've got the plaque build up. You've also got the receding there. Mainly the first four. And if I'm looking, it's not as bad anywhere else. Everywhere else looks alright, to be honest. The back is, but it's very red at the bottom. Yeah, at the back of the gums. And obviously looking straight ahead at the gums, you can obviously see the reddening there. Okay, yeah. Do you get any pain there? Okay. It's alright. Sensitivity there. Okay, possible filling on to the please. Thank you. Maybe slight erosion too. Thank you. Okay. Wonderful. Okay. Yeah, upper the palate. Yeah. Okay. Slightly receding as well. Plaque built up. Yeah, a lot of on there actually. Okay. Possible chip on 4A. Okay, so we have the upper left part erupted. Slight chip on left 3. Potential filling on upper right 3. And upper right part erupted. And then we have decay on some of them and plaque build up. And then obviously seeding gums again. Okay, let's just go through the bottom ones. It's erupted lower left. Front left is very thin. Okay. And this side, it's not even part erupted, it's sort of showing through. Do you have a lot of pain there? Yeah, I can see it, but it's not quite coming through, and there's food stuck over the top of it. I'm going to have to get this out, okay? So just nice deep breaths for me. That's nearly coming now. You're doing really well. You can just breathe nicely. Breathe. I know. There we go. Nearly done now. Excellent. Wonderful. Okay? Okay. That's fine. Good. And obviously the okay. Okay, we can just put some of it. Yeah, you got that pretty well. Yeah, okay, that's fine. Thank you very much. Okay. Thank you. Okay, let's need to pop this in. Might sting a little, okay? You're doing really well. That's it. Okay, just a really strong antiseptic, okay? So you can clean that out. Again. Good, well done. Great. Okay. I think I'm going to treat you for an infection. It's definitely infection started there. It's very red and swollen. Okay. Yeah. I'm only really concerned about that one. The others are just being slow. Thank you. Okay. Now I'm just going to paste something over your tooth. All right. Well, I say tooth. Slight bit of tooth in your gum. All right. And this is a really intense antibiotic. Okay. There we go. Is that all right? Good. Now, I just need to leave that on you for a few moments, okay? And then I'm going to have to get you to rinse your mouth with a special wash, which also has an antibiotic in it, okay? Yes, and it's also really good antiseptic and things, okay? So it's really going to clean out your mouth. It will start to go like a creamy colour on top when it starts to do its job, you know. You're doing good. Yes, 7.2 and the 3.5, please. Yeah. Yes, you could pop in the 3 actually as well. Okay, yeah, thank you. Excellent. Thank you very much. Right, so in a moment I'm going to get you to sit back in your original position and I'm going to get you to drink this. I want you to swish it around your mouth really good, spit it out, same again, spit it out. Okay, I want you to do it several times to me, but I want you to make sure you really wash it around your mouth, okay? Good. Alright, if you could just help them sit back up, please, thank you. Here we go. Alright. That's you're doing really well. Yeah, that's perfect. Carry on. Okay, that's fine. I'll put that back there. Thank you. All right. Good. All right. So, I had a really good look, and I get an idea of what's going on. All right. So we do have a fair bit of plaque build-up and a little bit of tooth decay on the odd tooth. Okay. Now, the thing is, when we get too much plaque, this can escalate and we can get bacteria, and that's when we can get, you know, infections and things like that. Okay, so we need to make sure that we are cleaning our teeth twice a day, okay, with an electric toothbrush, and you need to be using a good toothpaste and mouthwash twice a day. You need to brush your teeth for about 2 minutes. Okay, yeah, that's right. And we need to make sure that we are cleaning correctly. So we need to make sure you've got a really good toothbrush head, and we're going to let it flow around our mouth, and then we're also going to gently do this action. Okay, you can get some with apps and things like that, and it will tell you how to do it, what to do and when to do it. That might be useful. Some people find that really useful if they're having trouble brushing their teeth, and that okay. Yeah, that's right. As I mentioned, your wisdom teeth are part erupted, apart from the one that is obviously just showing very slightly, so I wouldn't class that as part erupted. Yeah, and it's broken through the skin, but what's happened is your skin's starting to grow back over it with your gum, and you've got food stuck in there and it's irritated and causing infection. I've now scraped out the food, obviously, and we need to treat the infection and the swelling. All right, because you are swollen, which is why you've been experiencing a lot of pain, discomfort, and a little bit of bleeding. All right, that's what's been happening. Exactly. And I'm going to suggest that you get a special toothbrush with a little thin bit, just to gently pop into the whole bit, just to brush. Now it's going to feel quite sensitive, but I suggest you do that at least once a day, and I suggest in the evening. All right, definitely, yeah. Okay, so that's what the problem was, and obviously with the swelling, you may find that you might swell here if you leave it too long. Yeah, that's right. So you will need some anti-inflammatory, definitely, and you will need some antibiotics, and you may even need some pain relief as well if you are in that much discomfort. Yeah. Wonderful. So we do need a really good in-depth clean. Okay, so in-depth clean, we're going to move away plaque, any build-up of decay, debris, all sorts of things like that. Okay, we're going to really clean the mouth out and give it a proper good clean. It will be very in-depth. Okay, but we need to do a really good job on that. Okay, and then we can get your nice teeth shining through. All right, yes. So we're going to have that. A slight chip. Any idea how you did that, or haven't you particularly noticed? Yeah. Okay, so it could have just worn away, basically, then. Yeah. Okay. All right. Well, at the moment, I mean, it's not affecting you, is it, pain-wise or anything like that, or sensitivity, which is great. So I'm not concerned about doing anything about that. Unless you are concerned about the way it looks, then there's obviously things that we can do to make you feel a bit better. Okay. Yeah, but are you all right with that at the moment? Okay, so you're not concerned about that. Okay, wonderful. If it does start to wear away a little bit more, then we will have to probably pop on like a crown. We can do veneer or something like that. We will need to pop something else on it if it does start to keep chipping away. But I felt it and it is very smooth. So there's no jagged edges or anything like that. So that is okay. I can't see it crumbling away anymore. But obviously if our oral hygiene isn't up to standard, it's going to start doing that. The receding gum line, I mean, I'm guessing this is from all the build-up of plaque you have and not brushing the teeth correctly and things like that, okay? Yeah, so when you use a mouthwash, you need to make sure you're cleaning and really giving a good job. But I'm going to start you on some Corsadol first, and that's just going to help the receding gum line. It's going to stop any bleeding. No, you haven't got bleeding gums or anything like that, or gingivitis or anything. It's just a little bit of irritation from it. So if you can take this for just 7 days, when you finish that, go on to a normal mouthwash. Okay, yeah, so just 7 days on that one. I will do your prescription for these, don't worry. Yeah, and then go back on just to a normal one, whatever you're using. Yeah, exactly that. So with your wisdom teeth, I want to leave them in at the moment. I just want to monitor them and see how they get on. All right. I mean, you have said it's been going on quite a while, so we'll just see how it gets on. All right. If you have any problems with any of them, please contact me and I'll get you in and have a look and see what's what. And if you need some treatment, then we can do it. All right, if we know if we're getting this and it's reoccurring, there's problems after problems, then we might as well just go in and remove them. All right, one of the tooths has a slight hole in it. Okay, and I don't know at this stage whether I should be doing anything with it. I mean, when I touched and things, you didn't react, so it's not deep enough that it's affecting the nerves and then it needs to be filled. Okay, but that is going to be monitored. Yes, we need to see how things, get on with that. All right, and if I am doing your clean and your tooth whitening, then we do need to obviously see other things like check on your wisdom teeth, check on the chip, and check on the slight hole that is coming. All right. Yeah, so I could just pop in like a white filling on top when I'm doing the whitening, if that's something that you're wanting me to do. Okay, and then with the chip, I mean, I could potentially build it up slightly with some other white stuff that I would use for a filling. Okay. Obviously, you can have time to think about this, don't worry. Fantastic. Perfect. Does that all make sense to you? Good. Have you got any questions about any of that? Great. So I'm going to do your prescription. Okay, so we want some more, and I want that one, I want antibiotics, I want that one, and we want anti-inflammatory. Have we got any cocodamol at all? Okay, I'll put some of that on as well. Okay, antibiotics need to be taken for 7 days, okay. All the instructions will be on the products, okay. Excellent. There is your prescription. Please make sure you get that today. It's very important. All right. You're very welcome, my lovely. Do you have any questions? Okay, well, I will see you in about 2 weeks for a follow-up, if that's okay, and then we can go from there. Perfect. You're very welcome, my lovely. You take care now. Bye-bye.